Ready for me to fire the first question at you, Heath?
Yeah, go for it, Beck.
Okay, so this is a big one. So dental insurance. Should I get is basically the question that the patient's asked.
That's a very broad question. It is something that I get asked at least once or twice a day. It's very topical in the media as well. You know, we talk about affordability of not just dental care, but medical care as well. And the private health sector in Australia, at least, is very much being asked to kind of pick up that burden of that affordability. So it is a very good question. It is something which I'll offer my opinions now, but this is very much an individual thing. There are so many different options around there. There's so many different needs, especially like dental needs for people. So it very much is, you've got to do your own research around it. Having said that, I will still offer my opinion, but it's just a guarded opinion, as always. Yeah. So I think the first thing that I always tell people, patients, is that the word insurance is a bit tricky. Like it's a bit of it kind of doesn't sort of, I guess, articulate exactly what it is. I prefer to call it a health fund. So insurance is usually, you have an accident in your car, you've got car insurance, you pay a premium, you pay an excess, and whatever above. So say you've got a $30,000 car and you get $20,000 worth of damage on it, you'll pay an excess of whatever, $1,000, $2,000, and then the insurance company will pick up the rest. So that's like a catastrophic, event, and it's an unaffordable event that happens, and the insurance company is there and they do a great job for those unseeable events. With dental insurance, it's very different. So it's kind of like the opposite, whereby they will cover you up to a certain amount. So people go into these things and they're like, okay, I fell over and I knocked 2 teeth out and I need 2 implants, or I need root canals and I need $5,000, $10,000 worth of dental work over a small period. I hope that never happens to anyone, but it unfortunately it does. Your health fund will only cover you up to a certain amount, and then you've got to actually fill in the rest. So as long as you're going into it knowing that, and you can kind of like differentiate it, dental insurance before like all the other types of insurance as part of other insurance, then it's fine. Because if you do go down the right path and you do your research, it very much can be something it does make dentistry more affordable, and it makes preventative care more affordable and basic care more affordable. So I believe it does. And I think the great thing about it too is it does force you to use up people are always trying to use up they've paid their money, they've paid their premiums each month, and fair enough too, they want to use it up. So it's great. So what we tend to see at least in my practice, and I know it is in many other dental practices as well, is that people like to get their money's worth from their dental insurance. So, which is great. It just means people come more regularly, things get attended to much at a much earlier time. So we tend to see those types of patients that are a lot more proactive. So in that way, I think people should. In terms of, like if you go to the dentist and you need a whole lot of dental work done, on a cost factor at that point, my opinion is it's not worth it. So yeah. I don't know. I was rambling there for a while. Did that make sense, Beck?
I know it's such a tricky question to answer, because obviously you've got to take into consideration everyone's personal budget, and the premiums they go up and up every year, and unfortunately the rebate that you get back quite often does not. And so I think the consumers, the patients, are becoming a little bit more this is top of mind now, and this question is getting asked more and more often, as people are definitely seeing that difference between what they're paying out with their premiums month by month compared to what they get back when they go to the dentist. So when we were preparing for this question, we had that conversation around the fact it's important to go and get a quote prior to. So the lead up to this question is we're going to tell you or teach you how to read a treatment plan when you go to the dentist. And that way then you can go to your health insurance company if you have one, or if you're looking to get into health insurance, and you know what to look for, because it is a bit of a minefield and it can confuse people a lot. There's item codes and tooth numbers and yeah. And so I think just gaining that knowledge early on about what's going to be best for you, and then going out there and actually, I hate to use the word shopping, but you kind of are, you know, because there is, I don't know how many, like 20, 25 different health insurance companies in Australia. And they all offer something different. And so you really do, it really does pay for you to shop around, because some kind of dictate who it is that you see. And you had a good point, Heath, when we were talking about it earlier about if you have a dentist that you go and see on a regular basis and they are what they call a preferred provider, or they're somewhat affiliated with that health insurance company, you might find that you'll get a better rebate if you go to that practice, because they do have an affiliation. But if your dentist
sorry to interrupt you. It's also, so I mean, there's controversy around there being preferential rebating. So you go to one dentist and you'll get a higher rebate, but then the kind of it kind of comes from the other side too, is that the health funds will dictate to a dentist as to what they charge. Yeah. Not all the time does that mean that it's cheaper. Oddly, sometimes it can be more expensive, but what you'll tend to see is that, it's from those both sides. So yeah, if you've got your favorite dentist and they're with that specific health insurance company, I'd say 99% of the time, it is going to be better that you're with that particular insurance company. It's controversial, dentists don't like it, but yes, absolutely. Yeah, and that's it. And we're all about trying to provide that transparency for you guys to be able to make that decision. And so, yeah, it does. And so if you have any questions about that, please, visit our website. We've got some really great information on there for this, and or shoot us an email as well. But talking with, I work on front desk, and so I definitely get faced with this question pretty much every day with patients and help them, walk through this path of trying to figure out what's right for them. And so, take the time when you go in there and speak with the front office team at your dental practice, because they are more than happy to help you navigate the way through a health insurance and how to maximize that for you as well. So, You're able to do it hasn't happened for up until recently, but can you put your card through and get a quote rather than, you don't have to actually claim on the spot? Is that right, Beck? Yeah. So a lot of it's really great these days, with technology, that you can claim on the spot when you do have some treatment done, and you can also get a quote at the time of the appointment as well. So you can find out what that gap payment will be straight up front. And I highly recommend that you get that done before you have any sort of treatment done, whether it's a checkup and clean or a crown and a root canal, because once you've had the work done, it can be quite a shock. And if you think that your health insurance company has told you that you are going to get 70% back, but in the fine print, maybe you do need to see one of those preferred providers or affiliated members that we spoke about. You could be out of pocket hundreds and hundreds of dollars without even knowing it. So it takes no time for the front office team to do that quote. If they don't have that facility online, a lot of the health insurance companies allow you to do those quick rebates online, or unfortunately it is a phone call to them. But I tell you what, it does pay. It really does. So. Yeah, because we'll often find people that come in and they're just not covered at all, because that's the other thing we didn't really talk about, was it, Bex, around eligibility. Like, you might be on one particular plan, it doesn't cover, it's usually split into general dental versus major dental, and it'll be around, so you could very well go in thinking you're on this percentage, and you get zip, you get nothing at all. And that's when dentistry gets super expensive. Like, it's more around the unknown and not knowing and the shock, like sometimes dentistry can be quite cheap, but when your health fund pays nothing, it's expensive. So. Yeah, and when you've been paying out, $100, $200 a month to be a part of it, so and don't fall into the trap that you have to have dental insurance either. So yes, it can come as one big package with your hospital cover, but it's just a matter of weighing it up for you and your family whether or not it's the right thing for you. So it for some and not for others. So Yeah.
Yes, that is a good point, Heath, with the major and general dental care. So they do split that up. So always be aware of that as well. So your general dental care is your routine checks and cleans and your fillings. And then major dental care is like root canals and crowns and dentures and those sorts of things. And, you know, most of the time you have those two sort of pots to pull from, and once that's run out, it's out, and it does not roll over to the next year, which is also a very important thing to consider as well. So yeah,
that's why we tend to see that mad rush, don't we? Like in December, like people are trying to get in. Well,
yes and no, because not all health funds are calendar year either. So this is where it becomes really confusing for people, is because your health insurance company could either run membership calendar year, it could be financial year, or it could be your membership start date. So again, that's another thing to be mindful of when you're working out what's right for you. So yeah.
So did we really answer this question like at all or not? No.
No.
I think like as a summary for me, I would think if you need a lot of work done quickly, I would say it's not worth it. If it's for little bits and pieces over time, and especially if the dentist that you really like is aligned or contracted and is a preferred provider for a particular fund, 100% I would join that fund and choose it. If your dentist that you love isn't, I definitely wouldn't suggest you go out and join a different health insurance and swap your dentist, because the cheapest thing is that you're going to go to the person that you like, you're going to be more frequent, and it's going to be more preventative.
Yeah.
So there we go. Is that a more definitive answer?
Sure.